What are common types of dental emergencies and what could be done? For example, a tooth pain or toothaches.
So we get asked what are some of the most common dental emergencies and what can be done about them. So first off, the most common one that we see is a toothache. So generally what we do for that is we're going to take a look in your mouth, take some x-rays so that we can identify the source of the pain. There's a couple of things that can be done. So if we do have time to deliver treatment, then we will try to do that on the same day. Or at the very least, we will try to get you some medication so that we can control the pain and get you back as soon as possible to fix the issue.
Abscesses or swelling?
So abscesses or swelling are acute infections that are occurring. So again, we will take a look to figure out why this abscess is occurring. The most common treatment that we do for an abscess is called an incision and drain. So we will cut the abscess so that we can drain it out, and that's the most crucial thing. Allow some oxygen to get in the area and help to prevent the infection from getting worse. And then from there, we want to look at treating the source of the infection, which is usually going to be a tooth that's broken down or infected, so that that abscess doesn't come back in the future.
Wisdom tooth pain.
So for wisdom tooth pain, typically what we'll do is we take a panoramic x-ray. So that's that large x-ray that goes around your head. That x-ray helps to show us the entire head so that we can get a good look at your wisdom teeth. And then depending on why the wisdom teeth are causing the pain that you're having, which is usually due to an impaction, which means that it's blocked from coming out, we can talk about options of extracting it, or in more difficult cases, we would refer that out to an oral surgeon to get that removed for you.
Bleeding or inflamed gums?
So for bleeding or inflamed gums, again, we'll take a look and figure out why it's happening. So for bleeding and inflamed gums, this is typically due to patients not having been into the dentist for a while. So they have a lot of bacterial buildup on their teeth. So what we typically will do for that is we will get you back in with a hygienist to do more of a deep cleaning and remove all of that buildup.
Tooth sensitivity.
So tooth sensitivity can be caused by a number of issues, such as a filling that's fallen out and now the under part of the tooth is exposed, or it can be something as simple as you have some recession, which is where the gum shrinks down on the tooth and exposes the root surface. Depending on the reason why that's occurring, we would get you in for treatment, or for example, with recession, it can be as simple as switching your toothpaste to a sensitivity toothpaste and then evaluating how that sensitivity improves from there.
Broken, fractured, or cracked teeth?
So with broken, fractured, or cracked teeth, treatment can vary. If it's simply that it's a small break, we usually can fix that with a simple filling. For larger cracks, or if we have a lot of tooth structure missing, that's usually when we need to go into doing a crown on the tooth. So a crown is like a little helmet that goes on over the tooth, helps to hold it together so we reduce the risk of that crack getting worse in the future. Then lastly, there are those scenarios, unfortunately, where the tooth has just cracked right in half or below the gum line. And unfortunately, at that point, there's no saving the tooth. So we have to look at doing an extraction.
Broken fillings.
So for broken fillings, typically we just have to remove the remaining portion of the filling, if there is any, and look at replacing the filling. If the break is larger and it's left us with a minimal amount of tooth structure, that's when we would need to look at doing a crown on the tooth that goes over top and helps to strengthen the tooth.
Broken dentures.
So for broken dentures, it depends on how it's broken, but typically what we will do is take an impression of the denture in your mouth, and then we will send that to our outside laboratory, which usually takes 1 day to fix the denture. We then get you back the next day, make any adjustments that are needed, and then you're good to go with your denture.
Loose or lost crowns, veneers, or bridges?
So with loose crowns, veneers, and bridges, if they've come out of your mouth, what we want to do is try to get it cemented back in as soon as possible. The issue is that if you don't have pain, like let's say the tooth had a root canal and you leave it for a while, what will happen is that the tooth will start to move, and then that veneer or crown or bridge may not fit anymore. So the sooner that we can get it cemented back on there, the better for your tooth and for that for that particular appliance.
When do I need an emergency dental extraction?
So for when patients will ask us when, so patients will.
The first one is a wisdom tooth extraction. When do you need an emergency wisdom tooth extraction?
I feel like for all extractions, it's pretty much the same. So I can just put them together.
Okay.
So patients will ask us when they need an emergency tooth extraction. So the main things are when we want to get a tooth out right away is that if we have obviously tooth pain that's happening, we want you to get you out of that pain as soon as possible. Other times are when you have infections. So if you have swelling that's happening in your mouth, we want to get that out of there right away so that it can heal. Other times, if we're not able to remove it right away, like let's say you have an impacted wisdom tooth that's very difficult to remove, we will get you on some medication, so some antibiotics and some pain medication, and get you referred out to an oral surgeon as soon as possible to get that removed. So patients will often ask us when they need to get an emergency dental extraction done. So the times that we want to get a tooth out of your mouth as soon as possible would be if it is causing you a lot of pain, or you are starting to get signs of infection, such as an abscess. We want to make sure that we can remove that source of infection as soon as possible. During the times where it might not be possible to remove the tooth right away, we would look at giving you some medication, so such as a pain reliever, such as Tylenol, and some antibiotics such as penicillin. Our goal is basically to make you as comfortable as possible until we can get that tooth out. And in some cases, if it is a very difficult extraction, like a wisdom tooth, then we would send a referral out to an oral surgeon to try to get that done as soon as possible.
Why might I need an emergency root canal?
You don't want me to do anesthesias later.
What would be some painless anesthesia options for an emergency dental extraction?
So some painless anesthesia options that we can do for a dental extraction. One of the options that we have in our office, because we do understand that usually patients that have these issues might be a little bit scared of coming in to get treatment done, would be nitrous oxide sedation or laughing gas. So what that is, it's a gas that you breathe in during the treatment. It helps to make you feel less anxious, so you're not as scared while we are doing the treatment. We then will do whatever we can as well to try to make the injection as painless as possible. So we'll put some topical gel on the gums, which helps to numb the gums before the injection is done. And then I'll do whatever I can to make the injection as painless as possible by trying to go nice and slow and making sure that you're fully frozen before we do any treatment.
Why might I need an emergency root canal?
You just pause it for a second.
Why might I need an emergency root canal?
So the main reasons that you might need an emergency root canal, or if you have a toothache or infection, it's always our goal that we want to treat the source of infection as soon as possible. If for some reason that we can't start the root canal right away, then we would get you some medication such as a painkiller or antibiotics to help with that infection, but preferably we want to do it as soon as possible. So the main reasons that we would want to do a root canal right away, an emergency root canal, would be if you are having a lot of pain or there is a large infection that's happening because of the tooth that needs a root canal. We want to get in there and remove that source of infection so that you can go back to living comfortably. If for some reason though that we can't start the root canal right away, then we would at least get you some medication such as a pain killer or antibiotics to help reduce the infection until we can get in there and actually treat the active infection.
Do you offer same-day care?
So we do. So at our office, when patients have a dental emergency, we always try to get them in the same day, at the very latest within 24 hours, to make sure that we can look at their issue and diagnose what's going on, so that we can come up with a plan to fix it.
Can I schedule late hour appointments?
To help out some of the patients that are. Patients will ask us if they can schedule late hour appointments. At our office on Mondays and Tuesdays, we are open until 7:30 p.m. To help those patients that do work 9 to 5 jobs, to get them in to take a look at their dental issues. So I hope I was able to answer a few of your questions. If you do have any additional questions, or you do need to schedule an emergency dental visit, please give us a call right away at 204-259-3804, so we can take a look at what's going on.